So last year, Texas saw a record enrollment through the ACA of nearly 4 million people. What do the numbers show this time around?
Yeah, we actually just got a recent snapshot from the Center for Medicare and Medicaid Services, and the people who signed up actually surpassed that enrollment from last year. Those numbers show that as of January 3rd, about 4.1 million or so Texans have signed up for the ACA Marketplace in 2026. As you mentioned, that surpasses the record enrollment from last year about by 150,000 or so. And to us, what these numbers show is that the ACA continues to be a place where Texans are able to get affordable access to health coverage.
Very interesting insight to see those numbers now, because I'm wondering, how would you say this ongoing debate over extending those enhanced subsidies is affecting enrollment?
Yeah, we have seen a lot of headlines kind of pointing to the increased premiums that are potentially happening with the enhanced subsidies expiring. I think what we really wanted to point out that there are affordable options out there for many Texans. What we've estimated that there are about 3.1 million or so Texans that were enrolled in the ACA in 2025 that should qualify and will qualify for a free plan. Those people who will be impacted by the end of the enhanced subsidies are primarily those who make above 400% of the federal poverty level. So for a family of four, that's about 120,000 or so. Those are early retirees, people who are self-employed. Those people will see their premiums go up, and you know, want to make that very clear that that is a problem. It is about 3.5% of those who were enrolled in 2025 last year, though. So when we're talking about the vast majority of Texans who will still qualify for a free or very low-cost plan, that is really what our focus is on.
Yeah, because there are still subsidies available that were baked into the initial law, not these enhanced subsidies that came during the pandemic.
Yes, that is correct. I think that's a lot of times where the focus is going around the enhanced subsidies, but as you mentioned, there are still subsidies that are available for people who make below 400% of the federal poverty level that allow them to get those zero or low-cost plans.
Okay, thank you for that context too. You touched on it there too, but how much more are we seeing people in Texas pay for their plans? Is there much known about that at this time?
Yeah, I think Texas is unique. We are in a better position than a lot of other states were. And actually that's due to a law that was passed at the Texas legislature back in 2021. Senate Bill 1296 by Senator Nathan Johnson and Representative Tom Oliverson. It was a bipartisan bill that allows Texas to benefit from the federal subsidies more than other states who have not passed a law. And what that means is that there are more affordable gold and bronze plans for Texans all across the state. And again, when people are going in and signing up, what they do see is that they are finding zero or low cost plans that are able to be for them and their family.
So time is running short for people to sign up to get health insurance through the ACA in time for February 1st.
Yes.
What would you like people to know about that process?
We have 2 more days before enrollment ends on January 15th for plans that start February 1st, as you mentioned. We are and have been encouraging folks all throughout the state to go and check to see what their premiums are. Like I said, there are zero and low cost plans that are available. We are encouraging, folks around the state, we're encouraging your viewers to go in and look for themselves, because there are plans out there for them and their family.
And that would be on healthcare.gov.
Yes, that is correct.
Okay, so Alec Mendoza with Texas 2036, thank you again for sharing this context and for joining us for the conversation.
Thank you for having us.
All right, enjoy your day.